Well, good morning, everybody. Hopefully we got you after a couple cups of coffee, and we're all ready to rock and roll. This is really Janae's story, and I'm just here to support, but the idea here is to just share that challenging the status quo seems to be the theme for the last 2 days, and so we want to talk a little bit about how we're able to help when employers do want to challenge the status quo, just simply because what we do at Quantum allows you to sort of break free from the norm. And here we are. We already introduced ourselves, but again, I'm Tamara Lang. I've been with Quantum for a little over a year. Prior to that, I was with Bold Health. Been in the healthcare space and health tech space for quite a while. Janae, I'll let you introduce yourself.
Yep, so I'm Janae Andrade, currently the Vice President of Total Rewards, but I have spent my career at Houston Methodist. Next year will be my 28th year. I'm going to start being one of those people that says I was born in the hospital and just like came down afterwards. It's like the best joke. But I come from the benefits side. I was benefits director for a couple of decades before I was in my current role.
So as we get started here, we're going to just kind of break down like what the challenge was that Janae faced and, ultimately how we were there to support. But like I said, Janae is going to kind of run the overall discussion. Janae, maybe you start out with just sharing a little bit about the structure of your organization.
Yep. So hopefully, I think there's hopefully a lot of Houstonians in the room, but we are a growing healthcare system. So we have over 35,000 employees and growing. We have over 5,000 physicians, and some of those I know are employed directly with us, but many of them are private physicians, and I think that's something a little unique in our Houston market. We are proud of, kind of our ranking in how our employees view us. All these ones I'm about to discuss were not because we took a survey and asked our employees. They were all independently done. We didn't participate in the process. So we're the number one employer in Texas and number 3 along best employers. And when we asked our employees in a total reward survey, what are the 3 reasons why you came to Houston Methodist and what are the 3 reasons why you stay? And what's at the top of that column for us is our culture. And if you've ever been a patient of ours, I think you feel that same culture in the way that we treat our patients is the same we want to treat our employees. And we really strive to make sure that those things are aligning. And I would say that our relationship with Quantum was really about a values alignment for us. It was about making sure that we were delivering. We have a very complex plan, kind of in the spirit of like bucking the normals. Like there's not probably anyone in the room who has a more complex plan than we do. And so when you have a complex plan, you have to have a partner who can explain it to your employees and then do that well, because they need to make sure that they're doing the right thing. Otherwise, things could really kind of backfire for them in some ways. And so our partnership with Quantum for us has been about having a good partner, having someone that we could rely upon on the other side, having someone that my service center felt that they could make a warrant transfer call over and walk away from that call and know that they were going to get the best customer service. So for us, our relationship with Quantum has been about being able to do what we need to do to administer the type of plan that we want to administer, and have the flexibility to kind of do it our way. And our GLP-1 program is certainly part of that same structure.
Can I make a plug for Houston Methodist right now?
I'll let you.
Service announcement, yes.
You've got the microphone, Chris. You can do whatever you want.
While we as an organization have our challenges with affordability, with not just Methodist, all health systems in the Houston market, when it comes to quality, Houston Methodist is par excellence. We are the regional leader for the Leapfrog Group in the Houston market with our 56 hospitals, and Houston Methodist, period after period after period, has straight A's. So I just wanted to acknowledge the quality and safety work that Houston Methodist does.
Yeah, we have a commitment to excellence across the board, and it's part of why it's been so easy for me to spend my career there. So,
yeah, great. And one of the reasons we love partnering with you. So obviously, why don't you break down like what the problem was?
Yeah, so for us, we started offering GLP-1s before what I like to say, they were TikTok famous. Our pressure came from our physicians. If you have never worked inside of a health system, the pressure you get from physicians is like none other than the ones from your employees. And so our physicians really wanted us to cover GLP-1s, and it was coming from that bariatric surgeon side who said, I want an option that's not surgery. And so we started offering it in 2022 and thought we would spend about $1 million as we started offering, make sure I'm on the right calendar year. Sometimes this time starts to march by, I'm on the wrong year. We thought we would spend $1 million in that first year. We spent $3.8 million. That didn't make me too nervous, to be honest. But then as we got into 2023 and by like May, we were at around 8 million, I started to feel pretty nervous about where things were headed. And if you think back to kind of that time period, those were when those drugs were incredibly hard to come by. You know, in our market, you know, it was you would have to call 5 pharmacists before you could find the dose that you needed to receive it. And so for us, it was about how do we, you know, what we love to do at Houston Methodist is provide the best patient care and the best quality, right? And so this was like, how do we provide the GLP-1s and do that at a way that was a predictable cost? Because the unpredictability was the part that we couldn't really wanted to handle, because we didn't want to have to pass along the increase to our employees that would have been required on the premium side. And so we're always trying to look at that affordability piece. You know, so when we look at kind of what we were able to, you know, do, we really tried to have that flexibility and cost control. Our relationship with Quantum, you know, really allowed us to have custom conversations with our employees around these changes. But for us, it was really about bringing down our costs. And I'm going to walk through what we did, but what I can tell you, and our CEO and I had a recent conversation on it, you know, for all the change that was implemented and for all the cost savings that occurred, the employee noise was almost non-existent. And to be honest with you, and I think for many of you who have been in this room, I think we've all probably implemented some things where it's like the employee noise is so loud, it's like, how do I get myself out of this? I don't want to talk about this problem anymore. And so this for us was one of the ones that was, I think, accepted by our employees. And I think, you know, for those in the Houston market, we also did it at the time where, you know, the UT health system said they were no longer going to cover the medications. And so for us, it was like the ability to say, we want to cover it, but this is how we're going to do it. You know, others have put in dollar limits, and we really went down. You know, our group that put this together was our medical director from our bariatric weight loss center, the administrative director. We had nurses from the bariatric side. We had, you know, us from the administrative side, but we intended to build it in a way that it was purely sitting over on the bariatric side, and it wasn't an HR program. It was a program that we were getting through the bariatric team. And so that's how we. So, you know, as we looked at what we did, ultimately, we tried to bring a fair amount of alignment between what we were already doing in a bariatric surgery and what this program could look like. And so to the most extent possible, we really mirrored those eligibilities that we had. And so 10 plus years prior to that, we actually had people who would come work at Houston Methodist just to get a bariatric surgery and turn around and quit. And so that have been some learning lessons for us. And we kind of didn't want that same thing to happen with GLP-1s, to be the magnet for why people wanted to work at Houston Methodist. So we did some things from a structure administrative perspective where you had to be on our medical plan for 2 years, not just an employee for 2 years, and that you had to be at least 18 years old. When we looked at our data, that was important to us. We really didn't see much that was happening. We're an adult-based hospital system, so for us that was a pretty easy line to make. We also put in structures around who the prescribing physician could be. You know, if you haven't taken a look at, if you're offering GLP-1s and you've not looked at who's prescribing those to your members, I would recommend that you take a look. It was a little startling. You know, there was anesthesiologists, there was dermatologists, there was OBGYNs. There were folks who, if you're going to be on a GLP-1, we feel strongly that you need to be monitored and that you need to be having the right support. And we didn't feel like those types of physicians were really in the right space to be doing that. And so that was an important, so we built our own BMI network. It's a primary care physicians, internal medicine physicians, bariatric surgeons, and then a few cardiologists who kind of cross over into that weight loss space for us. We also increased the BMI to 35, and for us that matched what we were doing on the bariatric weight loss surgery. And so that made that really kind of a little bit easier because the two were aligned, and it was a place that it was for our employees, like they could see the alignment between the two, and it really made sense. And so, and then really from that, what really has evolved is building a program where, you know, we have a nurse who is doing the intakes of everyone who's trying to enroll in our BMI reduction program. And in that intake, it is really a robust conversation where they're talking about what that person's health history has been. This person sits on, you know, they are a nurse. They have access to all the records that are within Epic. And they're able to really have a meaningful, deep conversation with that member to say, is this the right program, or is surgery maybe the better right first step, you know, for you? And so it's really kind of a split conversation. And there's some employees that from that conversation, they move over to having a surgical appointment. And then there's plenty of employees who go directly into the BMI reduction program, but we don't make the assumption that the BMI reduction program is going to be for everyone. There's criteria where the employee has to then participate in the program for 6 months before they're eligible to be taking the drug. Those classes are provided, so they have 6 months of educational classes that are run by our Bariatric Weight Loss Center. Those same classes will qualify that person if they end up needing to switch over to the surgery route, that those would participate in that process. Also, if they were within the last year. We also had criteria around step therapy. Obviously, there's some folks that the step therapy drugs are not appropriate. If that was the case, they didn't have to take the drugs, but they still had to wait the 6 months. And really from the spirit of, like, if we were going to invest this much money, we really wanted that person to really be in it, right? Mm-hmm. And to really be willing to stay engaged and really, have the change mindset that's going to be needed, because it's not just a drug we wanted them to take, we wanted them to change their behaviors that were behind that. So they have to participate in a class every month. Thereafter, at the 6 month mark, we built a relationship. CVS is our PBM, and kind of in the spirit of like pushing on them. I think we also at times get different results from them, but they really did work with us to customize what we were doing, and allowed my bariatric nurse actually holds the prior authorization, so she makes sure that everyone who's in the program, that you are with the right physician, that you have participated your 6 months, and if you're past your 6 months, that you've gone to your class for the month, and that you've gone to your weigh-in. And so we require that they lose that 5% of weight loss in that first 6 months, and if they don't, then they are a failure out of the program. And then the other thing that we have put in is an off-ramp. We didn't think it was really sustainable for us to have folks who just remained on the drugs for weight loss reasons for an indefinite amount of time. And so we've had the rule that when you reach a steady weight for 3 months, then you graduate from the program. And we're 23 months, kind of in, if you will. And so far have not really seen we have had people come back to our program, but it's because they failed out in the first place. They didn't reach that original 5% weight loss. And now they've kind of come back, and maybe they're taking a different drug, a different GLP-1 than they took the first time. So, we did all of these things, and at the end of the day, we had about a 90% cost savings, year over year. So we went from spending what we thought was $1 million to spending $3.8 million. And then the year that things kind of really came off the rails, we spent in the end the year was $17.8 million. And then as we went into the next year, we still had ultimately and we are a very nice organization, as I think I've already shared that. So we announced it as part of our open enrollment in late October, early November. We didn't fully implement the program until April 1st. We wanted to give people the time to adjust and know that if they weren't going to meet the criteria to enter the program, that they had time to kind of work out some other relationships. We have a relationship with Noom as an example. And so we wanted to give people lots of options of how they could effectively still work on weight loss if they weren't going to be eligible for a GLP-1. And so, in the end, when the trends have been at 135%, for we have been at negative trends because of where we have been, and we're really at less than a $5 per member per month cost on it. So our costs have really they're 10% of what they had been effectively, which is a place that allows us to kind of take it off the table from a cost perspective. And it's been and you can, one of the things that Quantum measures for us is, a net promoter score. And you can see from the results that we have here that our net promoter score that Quantum is measuring is that actually during the same time period, our net promoter score, increased. Mm-hmm. And so it really goes back to that it was a big change. And I won't say that everyone was happy the day that it rolled out, but I think they understood that this was a way that we needed to move forward. And at least we had a way that we were moving forward, and we weren't just simply taking people off the drugs with no other solutions. So
I think that's where Quantum comes in as well, is they have the opportunity to help share the message. When a member calls in and there's a question about the program and how that all works, they were educated to be able to make sure that those referrals go into the into the organization and that they're aware, and just help to spread the message appropriately. When you move your navigation away from a health plan and you bring it to a Quantum per se, you do add in a layer of that personal touch that really is missing from the health plan. The health plan really operates in such a siloed approach, and so programs like this just become very difficult to administer because there's too much coordination inside the health plan to make sure that pieces they get lost in translation. And so really when we're trying to challenge the status quo or make significant changes, you almost have to break the model a little bit and really think about what is it going to take to really reintroduce, whether it's a GLP-1 program or any program for that matter, so that you can really have the eyes on the member like we need to have them to ensure that the good decisions are being made, the appropriate paths are being followed, and that everybody's in alignment. And I think that as we move forward and we continue to see double-digit growth in our healthcare spend, it's important that we think about alternative ways to really challenge the model and think, is this really working the way it was meant to work, or is it time to really think about shaking things up a bit and kind of taking away those conflicts of interest. Having the health plan run everything, denials, member services, it's maybe not always the right approach if you're a self-funded group.
Yeah, I think the best thing for this year, and I have said it so many times, I even put it in my open enrollment communications, where like every employer is seeing double-digit increases and often having to pass those double-digit increases. This year we were at about a 5.5% trend, and it really is largely due to the programs they put in place around GLP-1s and not having to have the same trend as everyone else.
So we have just a few minutes left. Are there any questions that we can field from all of you?
Really impressive, and congratulations on building such a great culture. I'm curious on part of the strategy is obviously education and engagement. Sounds like you guys have really done that. On the other side of the strategy of bringing the cost down, where do you all consider compounded versions of these solutions, or is it only the brand name only?
We are only using the brand name. So, the FDA came out really strong against the compounding, and our pharmacy had been going down that path, really on the patient side, not necessarily for my side, but when the FDA came out with their ruling against that, we stopped all process of that.
I was just curious, with all the requirements in order to get access to a GLP-1, did CVS then hold the rebates back on those GLP-1s?
For us, we decided that, to be honest with you, the lack of transparency, it was hard to tell, right?
Yep.
And so what I can tell you is that we didn't see a change in our rebates. And then I decided at the end of the day that I was comfortable going forward because I couldn't spend 17.8 more. That was like kind of where we were. Like it was almost like whatever happens, but I can't sustain, this, and I can't not make the change because of the fear of our rebates. But in our situation, and we have market price checks in our contract, and we did not feel an impact of that.
I think what makes that impactful is that your utilization probably drops so much.
Yeah.
By requiring that it offsets
Yeah.
any loss too.
Yeah, and I will say one of the things that was like, how, like all things, it was like, And so one of the things that we did see that didn't work as favorably as we thought is that all of a sudden everyone became a diabetic because the prior auth on the diabetic side was a little easier.
Yeah.
And so we actually canceled all prior auths on the diabetes on 1/1/2025, and everyone had to truly use diabetic, scores, true testing, an attestation from a physician. It was no longer with the fact that you had metformin in your history that would let you get access to the drug, because that did also happen. So, and we saw when we did that, we saw about a 20% reduction, because our goal was not to keep diabetic people off. We just wanted to secure that path in a way that seemed appropriate.
I have a question. You've only had this for a couple of years now. Are you following those who have graduated to see where they are? Because again, what we hear is you're on GLP-1s, you're on them for life, so I'm wondering how that part is working out. And then the other kind of related to that, how has this impacted the number of bariatric surgeries that you're doing?
So on the first question, so the two physicians, I guess that's our timer.
The gong show.
The oven is ready for us to, anyway. So on the physician side, so we have a couple of physicians, the lead on the bariatric side, and then a cardiologist who have been working on a research program specifically around it. I would tell you that the results that I see on a quarterly basis coming back to me so far have looked encouraging. I think the part that has been a little bit interesting is that the overall failure rate, or because there's people who take the drug and it just does not work for them. We've seen that be around 15% of our population. And then remind me what your second question was.
The increase or decrease in bariatric surgeries.
Oh, I think we've seen a little bit of an increase, to be honest with you. But when you look at the two costs next door, I mean,
Oh, yeah.
two,
Yeah, I know what you're
it's,
talking about.
it's
Yeah.
like, I'm not so disappointed with that, to be
Right.
honest.
No, I understand that. So one other plug, for Quantum Health. They've been around for a while, and Kara Trott, their CEO, I became familiar with her a decade or more ago. She has a new book, or maybe it's not that new, but it's called No One Left Alone. It's really a good read. I've had the opportunity to take a look at it.
Yeah,
So,
if you would like a copy of it, stop by our booth and we can get one sent to you.
Yeah.
It's really provocative, and it tells a story about how she founded Quantum 25 years ago and her background, and it's a really great read, along with Chris Deacon's book.
yeah.
So.
Yeah.
Yeah, exactly. So again, a hand for these folks. Thank you so
Okay,
much.
thank you.